Hi, my name's Jacqueline. I'm going to be the nurse practitioner examining you today, and we're going to do a full head to toe exam. So we're going to start off with examining your hands here. Go ahead and kind of just lay them out in front of me, just looking at color. I don't see any discoloration, no lesions. I'm looking at your nail beds. I don't see any discoloration there, no nail clubbing. And I'm just going to check your capillary refill here, so you're just going to feel a little pinch on each finger. I'm just checking to make sure that color returns quickly. Good. Capillary refill less than 3 seconds. All right, I'm going to have you just remove your sweatshirt here so I can take a look at your arms. All right, thank you. I'm not seeing any lesions on your arms. No lesions noted. Color looks good. I'm going to check your radial pulses here, so go ahead and just kind of I'm comparing bilaterally, and they are both about a 2+. All right, we're going to check sharp dull sensation, or we're going to actually do some range of motion here next. So first I want you to flex your wrist back like this and completely down. Good. Now up like this and flip. Good. Make a fist. Good. And now I want you to kind of tilt them out and in. Good. All right, we'll look at the elbows now. Go ahead and put your arms out in front of you. All right, bend all the way in. Good, and out. Perfect. And with your shoulders, go ahead and hold your arms all the way up like a zombie. Good. All right, and then I'm gonna have you go all the way out and up. Sorry, all the way out and up, yep. And then all the way back around and cross. Good. All right, and then we're going to have you put your hands behind your head. Good, and then kind of reach around to try to scratch your back. Good, that's just checking range of motion of your shoulders and elbows. We're gonna check strength now. Go ahead and put your arms out to your side. I'm gonna try to push down, don't let me. Good. All right, and then pull your elbows up like this. We're gonna check your elbow strength. Don't let me pull. Good. Push against me. Good. And then we're gonna check hand and wrist strength. Go ahead and press against me like this. Press against. Good. I'm gonna try to pull your fingers down. Don't let me. Good. All right. Now we're going to check your reflexes. So I'm going to start off with checking the biceps reflex here. So go ahead and just bend up once so I can feel that tendon. Perfect. Okay. I'm just striking over that tendon. Okay. And do the same thing on the other side. Go ahead and bend up once for me. Good. I'm just striking right over my thumb. Good. All right. And we're going to do the triceps reflex now. So just dangle your arm out to the side, kind of like, yep, there you go. I'm feeling for that tendon. Good. So far, all your reflexes are expected and normal active. All right, feeling that tendon, strike. Good. Okay. And now the brachioradialis. So we're looking for a little contraction at the wrist. Okay. That's him on this side. There we go. Good. All right. Next thing we're gonna do is I'm gonna have you do rapid alternating movements on the hands, or on the thighs, sorry. So just flip your hands back and forth as fast as you can and do that about 10 times. Good. Next, I'm going to have you close your eyes and put your index finger to your nose on both hands. Good. All right. And then next thing we're going to do here is I'm going to give you a couple different items, and then you just tell me what I'm putting in your hand. So go ahead and close your eyes.
A set of keys.
Yep. All right. Go ahead and close your eyes. And the other hand.
Some Scotch tape.
Okay. Alright, next we're going to do a test called graphesthesia. That was stereo Grasna. So go ahead and put your palm out. I'm going to just be tracing a number or a letter. You just tell me with your eyes closed. Tell me what I'm drawing.
2.
Good. Other side.
3.
Good. Very good. Alright, next we're going to do sharp and dull sensation on your upper extremities. So I'm going to have you close your eyes, and then I'm going to be touching you with something sharp or dull, and you just tell me if you're feeling sharp or dull as soon as it hits you.
Okay. Sharp. Dull. Sharp. Sharp. Dull. Sharp. And dull.
Good. Alright, and next we're going to just palpate the nodes in your axillary area. So go ahead and just lift one arm up for me. Just let me know if you're having any tenderness. Any tenderness with any of that?
Nope.
Okay. Alright, we're going to move on to the head, neck, kind of face portion of the exam. So first I'm just going to start by palpating your head and scalp. So just kind of put your head down for me. I'm just checking to see if I feel any lesions or any bumps or anything abnormal, and making sure it feels nice and symmetric, which it does. All right, and next we're going to check cranial nerve 7. We're going to do what's called the facial gymnastics. So I want you to smile for me, frown, puff out your cheeks, purse your lips, eyebrows up, wrinkle your face, make an angry face. Good. Close your eyes really tight. Good. And with that, I was just checking for symmetry, and everything looks nice and symmetric. And next I'm just going to be palpating your sinuses. So we're going to start with the frontal sinuses. Any tenderness with that?
Nope.
Okay. And then I'm going to do your maxillary, same thing. Any tenderness?
Nope.
Okay. And I'm going to percuss them now. So again, just let me know if you have any tenderness. You can look ahead though, yeah. Any tenderness with that?
Nope.
All right. And we're going to check cranial nerve 5 next. So I'm just going to be putting my hands around your jaw, and I'm just feeling for even clenching on each side. So go ahead and just clench your jaw for me. Good. Nice and symmetric on both sides. And we're going to move on to the eye portion of the exam now. So start with the pen light here, and I'm just going to be, I'm just going to move this back just a little bit, and I'm just going to be looking into your eyes here. All right, so we got a bright light. Look straight at me here. Okay. So I'm just making sure that's checking the corneal light reflex, and the light appears the same in both eyes. So that's normal. And the next thing we're going to do is check the 6 cardinal fields of gaze. So go ahead and follow my pen here. Keep your head still. All right, I don't see any nystagmus. Next, we're going to check perla of the pupils. So I'm just going to be shining a bright light into each of your eyes. I'm just checking to make sure they constrict. All right. And your pupils are about a 2 to a 3, and they were reacting briskly to the light. And I saw a good consensual response between both pupils. And then just go ahead and follow my pen light here. I see good convergence of the eyes and constriction of the pupils, accommodation when I'm moving my pen light in. So the next thing that we're going to do is just kind of look at the external structures of the eyes. So I'm just looking here. Your sclera looks nice and white, moist, and your cornea looks nice and transparent. and your iris marking is clearly visible. I'm just gonna kind of gently palpate around your eyes here. Any pain?
Nope.
Okay. I'm gonna pull your lower eyelids down, looking at your conjunctivae, which look nice and transparent. Good. All right, and now we will do look in with an ophthalmoscope, so I'm just gonna turn the lights down for just a minute here. All right, so I'm going to be checking for the red reflex to start with here. All right, red reflex is present. I can see the optic disc, the margins look clear. I'm visualizing the retinal vessels. And we'll do the same thing on this side here. Red reflex is present. Optic disc has clear margins, and I can visualize the retinal vessels as well. So again, I saw the red reflex, optic disc margins, and the retinal vessels with that. All right, and next thing we're going to move on to here is vision screening. So I'll go ahead and hold that. I'll turn the lights back up a little bit here. And just hold that about 12 to 14 inches from your face, so that, and then just read the lowest that you can.
Okay. 8745 63925 428365 374258.
Good. All right. Perfect. All right. I'm just gonna switch over some equipment here, and we're gonna move on to the ear portion of the exam. Okay, so actually I don't need this quite yet. So first I'm just gonna look at the outside of the ears on both sides. Don't see any drainage. I'm inspecting over here. No drainage, nothing out of the ordinary. I'm just gonna lightly palpate. Let me know if you have any tenderness. Any tenderness with that?
Nope.
Same on the other side. Slightly tugging at the ear. Any tenderness with that?
Nope.
Perfect. All right, I'm gonna do something called the gross whisper test now. So go ahead and plug one ear. I'm gonna go behind you and whisper a word. You tell me what I'm saying. Pillow.
Pillow.
Good. And other side? Christmas.
Christmas.
Good. All right, now we'll move on to actually looking inside the ears here. All right. Okay, so I do see some earwax. That is normal. I can visualize the tympanic membrane. It's a pearly gray color, and the cone of light is at 5 o'clock, which is normal. Yeah, I'm going to move the other side here. All right, again, I see some earwax, but it's not obstructing my view. I can see the tympanic membrane. Pearly gray in color. Cone of light is present at 7 o'clock, which is, again, normal. All right, we're going to do some hearing tests now, some more hearing tests. So we're going to do the Weber test first. So I'm going to strike this tuning fork, and then I'm going to place it on top of your head, and you let me know if it sounds the same on both sides or equal or louder on one side.
Sounds pretty even.
Okay. All right, we'll do the Renee test now. So we'll do each ear. I'm going to strike the tuning fork. I'm going to place it behind the bone behind your ear. You let me know when you stop hearing it. Then I'm going to move it in front of your ear, not touching. You let me know when you stop hearing it.
Okay.
Okay.
Now.
And so we were just looking that air conduction is twice as long as bone conduction roughly, and yours definitely was, so we'll do this side now.
Kept on. Now. Now.
All right, very good. Same thing is about twice as long, so that is a normal and expected finding. All right, now that we're done with the ears portion of the exam, we're gonna move on to your nose. So I'm just gonna be looking first. Don't see any abnormal lesions or drainage. I'm gonna just lightly palpate. Let me know if you have any tenderness. Anything?
No.
Okay. We're gonna check your nose patency. So I want you to occlude one side and just sniff in. On the other side. Very good. All right. Now I'm gonna take a look inside your nose here. Okay. Looks nice and pink. The nasal septum is intact. I'm not seeing any polyps. No polyps or lesions. Same on the other side. And again, looks nice and pink. Good. Nasal septum is intact, and I did not see any lesions or polyps either, so that's good. And next I'm going to check your sense of smell. So go ahead and close your eyes, and I'm just going to put a familiar scent under your nose, and you just let me know what it is that you're smelling.
Coffee grounds.
Good. All right, moving right along here. We're going to do the mouth and throat portion of the exam. So first I'm just going to take a look inside your mouth here. I'm going to be looking at the gums, the inside of your cheeks, your mucous membranes, and all of that. Just going to stick, yep, that's good. I'm just looking with the light here. Your teeth look good. Mucous membranes look nice and pink, no bleeding. Gums look good. Nice and pink, no bleeding on the gums. Okay, so now what I'm gonna have you do is say ah.
Ah.
All right, and I saw symmetric, the uvula went up symmetrically when you said ah. And I'm also gonna look at your tonsils here. The tonsils look good, about a 1 to 2 plus in size, no swelling or drainage, no redness. It looks good. And then go ahead and just stick your tongue straight out for me. Good. All right, perfect. So now I'm going to actually check the strength of your tongue. So I'm gonna put a hand on a cheek, and I want you to push your tongue against that cheek. Good, and this side. Very good. All right, and then I'm gonna have you put a sip of water in your mouth, and I'm just gonna observe you swallow the water. Good. I saw the up and down movement as you were swallowing, so that is normal, and you didn't seem to have any issues swallowing the water, so that's good. We'll move on more to the neck portion here now. So I'm just inspecting the neck first, making sure it looks nice and symmetric, and I do not see any discoloration. All looks nice and symmetric. So we're gonna go ahead now, and I'm gonna palpate your lymph nodes. So you have a bunch kind of throughout your ear and neck area, so I'm gonna be feeling for those. Let me know if you have any tenderness, and I'm just checking to see if any of them are enlarged. So I'm palpating the pre-auricular nodes right now and the post-auricular. We're doing the occipital, which are a little further back. I'm going down the superficial cervical chain, the deep cervical chain, and then the posterior cervical chain. Any tenderness so far?
Nope.
All right, and then I'm gonna go submandibular here. And your submental, right below your chin. Any tenderness?
Nope.
Okay, nothing was enlarged, so that's good, that's normal. And next what I'm going to do is feel your carotid pulse on each side. I'm gonna do one at a time here. And it's nice and regular, and it's 2+, it's strong. I'm gonna do the other side here. And again, 2+ and strong. And we're just gonna do a quick listen, make sure there's no bruit that could show turbulent blood flow. Good. I don't hear any bruise. So next I'm gonna palpate a couple different things on your neck. And we'll start with the trachea. And I'm just making sure it's nice and midline. Feels good. And that's I'm gonna feel your thyroid. Kind of on either side of the trachea. Feels nice and smooth. I don't feel any nodules. Is that tender at all?
Nope.
Okay, does it not feel enlarged? Next we'll go ahead and do the range of motion of your neck. So go ahead and move your head from look side to side. Good, up and down. Good, and then kind of tilt to each side. Good. And there was one thing I forgot to do. I'm gonna go back and do really quick. I'm just gonna feel your temporal arteries. Good, nice and equal on both sides. I don't feel any thrills. Okay, so we're gonna move on to the posterior portion of the lungs now. So go ahead and actually turn all the way around for me if you could. That should be good there. Okay, so starting off with inspection, I'm looking at the AP diameter, and it does appear a 1:2 ratio, which is normal. I'm just watching you, just breathe normal. Chest looks symmetric. I do not see any intercostal retractions, no signs of labored breathing. Thing looks good. I'm going to palpate now. We're gonna check thoracic expansion. So I'm gonna place both of my hands. You just take a deep breath in. Okay. I'm just making sure my hands kind of moved evenly on each side and that you were able to, I could see equal rise and fall. So the next thing that I'm going to do is a test called tactile fremitus, and I'm just going to be placing my hands over different portions, and you just repeat the word 99.
Sure.
I'm just feeling for vibrations.
99. 99. 99. 99. 99. 99.
Good. Tactile fremitus was expected and even throughout. And next we are going to percuss. Good. And then I'll do each side as well here. Good. And the other side. heard resonance throughout, which is what we want to hear, and that is expected and normal. And now I'm going to do a test called egophony. So I'm going to have you do every time I move my stethoscope, do a long E sound for me.
Okay. E. 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 E.
All right. Negative egophony, because I heard a muffled E sound throughout, and now I'm just gonna listen to your breath sounds in all fields here. I'll do posterior and lateral. So just take a deep breath in and out each time I move my stethoscope. Go ahead and breathe normal for a minute here. All right, and now listen on the lateral fields here. Deep breath. Good, and the other side. Good. So in all the posterior and lateral fields, breath sounds were all present and equal and clear, and I did not hear any abnormal breath sounds throughout all that. So that is good. And now we will have you flip back around there for me. We'll do the anterior portion of the lungs here. So same thing, just looking at the chest. I don't see any retractions. Your breathing looks easy and unlabored. I'm going to go ahead and I am just going to check a respiratory rate on you. I'm going to be feeling your pulse at the same time. You just breathe normal. For a full minute here. All right, your respiratory rate was 14, which is normal. 12 to 20 is normal. So now, again, just looking at the chest, everything looks symmetric. I don't see any lifts or heaves, and I'm gonna just palpate now. Let me know if you have any tenderness. Any tenderness?
Nope.
Okay. I don't feel any lumps. I'm just gonna go ahead and listen to your breath sounds on the front now. Same thing, just deep breath in and out each time, please. I'm listening with the diaphragm. All right, and the next thing I'm going to check here while we're at it is your skin turgor. So to go ahead and just kind of put your, and I'm just going to do a little pinch here. I'm just making sure there's no tenting of the skin, which there was not. All right, so now we can move to the heart portion of the exam. So we'll kind of move the camera, and if you want to just go over there. Yep, lay all the way down for me if you can. All right. All right, so first I am inspecting the precordium. Gonna move some stuff here. All right, and I'm looking to see if I see any lifts, heaves, or thrills, which I do not. I'm gonna just put one palm over the precordium. And I'm just, again, feeling for any lifts, heaves, or thrills. I don't feel anything abnormal. No skin discoloration on the chest either. I'm going to locate the PMI here, which is the apical pulse, and that is about the left midclavicular line around the fifth intercostal space. So I'm just going to feel it first. Good. And now I'm going to listen, and we're going to do your heart rate here. All right, your heart rate was about 85. That is normal. So the next thing we're going to do is locate all your landmarks, your heart valve and cardiac landmarks here. So the aortic valve is located on the right sternal border, second intercostal space. And then going over to the left sternal border, second intercostal space, is the pulmonic valve. And then if you go down to the third intercostal space at the left sternal border, you're at Erb's point. Then if you go down to the fourth intercostal space at the left sternal border, it's the tricuspid valve. And then the midclavicular line, fifth intercostal space, also known as, it's the area of the apical pulse or the PMI, and that is the mitral valve. So now that we've located all 5 of those landmarks, we're going to listen to each of them, first with the diaphragm and then with the bell. Moving down to the mitral valve. All right, S1, S2 was present throughout, no murmurs or extra sounds. Same thing with the bell. Moving over the pulmonic. Down to Erb's point. Tricuspid valve. And mitral. All right, and again, S1, S2 was present throughout, and no murmurs noted. So we'll move on to the abdominal portion of the exam. If you're able to scoot down maybe even farther just so your head's kind of flat too. There you go, perfect. All right, so first thing we're gonna do with the abdomen is inspect from eye level here. All right, I'm looking at the contour, I don't see any bulging, and I'm not seeing any like blue skin discoloration or anything like that. What I'm gonna have you do next is just kind of put your chin to your chest. Good. I didn't see any bulging and it didn't look like that was painful for you at all. So the next thing that we're going to do with the abdomen is we're gonna listen to bowel sounds. I am listening with the diaphragm here. I'm going to listen for about a full minute total. And I am listening in all 4 quadrants. There's 4 total. All right. And you had about 20 vowel sounds in a minute, and 5 to 35 is normal. So that's good. And next we're gonna be listening to, there's 5 points I'm gonna listen for vascular sounds. So I'm just gonna have you keep doing as you're doing. I'm just gonna listen, only I'm gonna listen with the bell this time. First listening over the aorta here, which is the midline area. All right, moving down to the renal arteries. There's 2 on either side. And moving down to the iliacs, below the renals, 1 on each side here. And I do not hear any bruits or venous hums, so that's good. And next we're going to move on to the percussion portion of the exam here. So we're going to be percussing your abdomen now. Are you able to move that way just slightly for me? Perfect. Okay. All right, so I'm going to percuss in each quadrant here. And the main sound throughout the abdomen is usually tympany. That's what I'm hearing, so that's good. And then I'm gonna actually percuss for the livers of your border here, or the borders of your liver. You can go ahead and move your arm kind of out to the side there. So I'm gonna start percussing over your lungs down, and I'm gonna, when that sound changes from resonant to dull, I'm gonna mark, and then I'm gonna do the same thing starting from the belly going upward when it changes from tympanic to dull. And then that'll give me the borders of your liver so we can measure. Okay, I heard that change in sound there. Mark. And then same going up. All right, and I heard it again. Mark. All right, and then I'm just gonna measure. So normal is 6 to 12, and you are right at 6. So that's good. And then now we are going to try to percuss the spleen. Sometimes it's well hidden behind the rib cage and you can't unless it's enlarged, but I'm going to go ahead and try here. So we're just going to percuss from the belly upward. Okay, so I did hear kind of a changed dole here, and that is kind of at about the 10th intercostal space, which is normal. So we're going to move on next to palpation. First, we're going to just do some light palpation throughout all 4 quadrants, and just let me know if you have any tenderness. Any tenderness?
Nope.
Good. And now we're going to do some deep palpation. This sometimes is a little bit tender, even normally, so just to warn you, but just let me know if you have any sharp pain. I'm just feeling for any masses or lumps. Doing okay?
Yep.
Does that feel okay?
Yep.
Okay. I didn't feel any lumps or masses. Next, I'm going to try to palpate your liver. So I'm going to kind of hook under your right rib cage here. Go ahead and take a deep breath, blow all your air out. Good. All right, go ahead and take a deep breath in for me. Good. And with that, I could feel the edge of your liver come down, and feels nice and smooth and does not feel enlarged. I didn't notice a mass or anything like that. And then the spleen is usually, again, well hidden behind the rib cage, but we will try to palpate it since we weren't able to percuss it. And we'll just see. So go ahead and take a deep breath in. Yes, and I do not feel the spleen, which again is normal, so nothing to be concerned about there. And next thing I'm going to do is just feel your femoral pulses while we're here. And then I will also listen to them. Feels 2+ and regular. This side. Good. And we'll go ahead and listen now. I'm just going to pull your shorts down just a little bit here. Good. 2+ and regular. Sounds regular in rhythm. Don't hear any bruise or anything abnormal. And then real quickly, we're just going to palpate your inguinal nodes, which are kind of in your groin area, and just let me know if you have any tenderness.
Good.
Any tenderness?
Nope.
Okay. I do not feel any enlargement. All right, so we'll move on to the lower extremities portion of the exam. I promise we're getting close here. So I'm going to start off by just inspecting. I'm looking at hair distribution, which looks even, and skin color looks even, no lesions. And I'm going to go ahead and palpate your legs now. Just let me know if you have any tenderness. Anything with that?
Nope.
All right. We're going to do sharp dole sensation now. Similar to what we did before on the arm. So go ahead and close your eyes and just let me know if what you feel is sharp or dull.
Sharp. Dull. Sharp. Sharp. And dull. Sharp. Sharp. Dull.
I'm going to do your feet too.
Sharp. Dull.
Other side.
Sharp. Sharp.
Good. All right, and now we will check your pulses in your feet. So I'm going to be feeling your dorsalis pedal pulses. And I'm comparing them bilaterally, and they feel the same on each side, and they're 2+. And your posterior tibial pulses, nice and strong, definitely a 2+. Equal on both sides. I'm just going to palpate for any pretibial edema here now. I'm not feeling any edema. All right, so we're gonna kind of go down to the toes here now. And I'm just looking at the color and the nail beds, and looks nice and pink on both sides. No discoloration of the nail beds, no clubbing that I can see. And next we're going to do cap refill. So I'm just gonna do a little pinch on each toe, kind of like I did with the fingers. All right, capillary refill is less than 3 seconds. And next I'm gonna do the position sense of your toes. So go ahead and close your eyes, and I'm just gonna move your toes up or down, and you let me know which way I'm moving them.
Okay. Up, down, up, up,
Good.
down, up, down, up.
Good. All right, we'll move on to some range of motion now. So I'm going to start with the range of motion of your hips. So go ahead and kind of just let me move your leg here. I'm going to go all the way back and out. Good. And then bend all the way at your knee and out. Good. And then we're going to keep your leg straight, and I'm just going to hold it in my arm. We're going to abduct and adduct. Good. I'll do this side now, checking the hip range of motion, all the way in as you can, and all the way out. Then bend at the knee, all the way in, out. All right, and then just let me move again. I'm gonna go abduct and adduct. Good. Any pain with any of that?
Nope.
Okay. I'm gonna check some strength now. Go ahead and lift this leg up. Don't let me push it down. Good. All right, I'm gonna try to pull. Go ahead and rest it down. I'm gonna try to bend you at the knee. You resist me, okay? Good. Lift this leg up for me. Don't let me push it down. Okay, and relax. Try to bend at the knee. I'm gonna resist you. Good. And then lastly, kind of put your leg up, like bend your knee all the way. Try to straighten out. Good. And this one. Try to straighten out. Good. All right. So that was strength of knees and hips. And then now I'm going to have you do the heel to shin on each side. So go ahead and heel down your shin, heel down your shin. Okay. So now I'm going to have you come back to the stool, and we will sit and do some reflexes. Okay, really quickly before we do that, I'm going to do the position sense of your hands too. Let's go ahead and just close your eyes and let me know if I'm moving my finger up or down.
Up, down, down, up, up, down, up, up.
Good. All right, we can move on to reflexes now. So go ahead and just kind of dangle your knees. Me checking your patellar reflexes here first. All right, saw that there. And this side. Good. All right, and we'll do our Achilles reflex. So right behind that Achilles there, I'm just going to strike. Okay. And again, Achilles reflex on this side. Okay. And next I'm going to check the Babinski reflex. And put your foot up this way. Good. Saw the toes curl down. Good. All right. And you can go ahead and really quickly, you can put your sweatshirt on, and then we'll do the last portion of the exam. And to end it here, we're just gonna be assessing your gait, how you walk. So go ahead and start at that end over there. Okay. All right, so first I just want you to walk normally for me. Good. Go ahead and walk heel to toe. Very good. On the way back here, I want you to walk just on your tiptoes. Good. And now walk just on your heels for me. Very good. All right, I'm gonna have you do the heels one more time.
Go.
Yep, walk on your heels for me. And then walk back on your toes. Good. Alrighty. Okay, so a couple last things here. Go ahead and stand and face that wall. We're just gonna be checking the curve of your spine, so go ahead and try to bend down and touch your toes. I'm just feeling that the spine is nice and straight, there's no curve to it. And then go ahead and stand all the way up. And I'm checking your scapula are in line. I'm gonna lift up your shirt a little bit here. The top of your iliac crests are in line. And gluteal folds are in line, so no lateral curvature signs there. And I think that concludes the rest of our exam. Thank you.
Thank you.